Right. Good afternoon, good morning, good evening. Welcome to Black Mental Health Matters, World Mental Health Day, Mental Health in an Unequal World. My name is Marcus Banks Bay. We're live on Black Mental Health Matters on YouTube and LinkedIn Live page, United States of Africa Facebook page, and on Twitter, Al Kibalan and Africa Republic. You can enroll on Patreon to support Black mental health matters. And again, this is a worldwide movement. We need your support. We need your attention. This is not just for the person speaking or those in attendance. This is for all of us in the diaspora. We have a great selection of panelists here with us today. Some you may have seen before, some you may not have seen. And I'd like to introduce some of us today. We have Dr. Judith Bruce Golding. She is broadcasting live out of the UK. She brings a wealth of knowledge and education and should I say information from her background. I'm going to introduce a few more as I add to the stream. We also have Dr. David, Sister Olorutoyin, finally rolling off of the lips there. Dr. Dia, this is my first time being able to host you. I want to say welcome. I hope your family is safe and you're doing well. Okay. Uh, Ruth, because I'm not in the game of butchering names, I'm going to go with the shortest, right, and the most easiest pronunciation, and I'm going to let you all take your names from there. All right. Mr. Basiru,
Right.
welcome, right? And so as we are getting started today with World Mental Health Day, we know that mental health is not only a touchy subject, right? But you would think that um, with the body taking so long to form, but the brain taking 25 years, right, to complete its growth and development, solidify, right? You're not technically an adult until you're 25 years old, right? But yet and still, there's this piece where mental health is put into this category where you shouldn't speak of it. Let's talk about why that's seen as something. Should I say that's stigmatized? That's put into a category, and with that, maybe mental health is a question of inequality. So maybe we can start with one of our panelists who haven't been here in a while. Dr. Dia. Dr. Dia, are you ready to take us into this conversation? Is mental health a question of inequality? Can you let us know where you are speaking from, your country of origin, your education specialty, and give us some insight?
Absolutely. Well, hello, everyone. I wanted to start by saying thank you so much for the opportunity to be on this platform. My background is I'm in Chicago, Illinois. I'm in the U.S. And my background started in mental health psychology. I went to University of Chicago and went on to get my master's in health sciences, and then went on to get my doctorate. And then in between that, did get another master's in public health. So I'm very passionate about the topic. And so I would say, yes, most definitely, it is inequality. And I have to speak upon the fact that, and I have a book coming out, and the book talks about racism and mental health. And so that's one of the things I think that we also have to highlight first, that's the major inequality that's facing across the African diaspora, right? And I think most importantly, as I'm in the US, we have to talk about George Floyd's killing and really how it's mandated a reexamination of structural racism in the United States, but I think globally. I think that became very global. And the malignant policies and things that are going on with policing and disparities and inequalities, especially with COVID. And so, most definitely, I want to just start this conversation out with there is definitely inequalities when we look at mental health, and especially impacting African descent, Latino X, which I am also from, and especially in the United States. It is something, the CDC and NPR said that racism is declared a public health crisis, but it has such an impact on our mental health and then just equalities overall. So I guess I'll start there and then open it up to the rest of the panel.
And that is a beautiful start, especially since the U.S. is seen as a world leader in health and medicine, right? Um, and the University of Chicago is one of those global researchers, right? So, well, kudos to you for that, right? Being at the top of the top. Right? Being able to speak from that position, if you will, of expertise and authority, if you will, having that lens and supporting us in this fight, if you will. So, again, we have this global public health crisis, this emergency, racism, which contributes right to mental health crises, and this goes unspoken, unacknowledged. So thank you for bringing that piece of it into the conversation. Someone who we've heard from before, but not enough, Sister Olorutoyin. How would you like to introduce yourself and bring your perspective out of Germany into, well, I would say out of Germany, but not the origin, right, of Germany, if you will, of Dutch's land, into this conversation? Please help us from your perspective.
Yeah, thank you very much. I'm a psychosocial counselor, and I love to bring in an African-centered perspective into my work. Definitely, the inequalities which are experienced by people with mental illness are a great issue. Inequalities in health are related to the inequalities in the society. So it's not possible to separate that. And already we find here the conditions in which people are born, how they grow up, how we live, how we work, how we age, how we get old in this society, all matter and all have to do with all, you see the unequal distribution of all these social determinants. You see them also applying in things such as education, where we live, the kinds of jobs we have. And here in Germany, where most people of African descent tend to be to have come here as migrants or as refugees, and you have an immigration system which actually tries to hinder the access into the system, then you really can't see the inequalities. So people come here and for the longest time, it was said that this is not a land to migrate to officially. So people come here and have really to go through precarious situations to get the necessary resident permit, or being in a relationship with a German, or having a German child, was the only way to have official access to residence. And you can imagine what happens when refugees come here and they are not really given the necessary care that is needed, coming from war countries, coming from areas of conflict, and having to survive somehow. So here, this is a very big issue in the refugee, especially in the refugee migrant group, and also even with those who are of African descendants and have the German nationality. Also, what has been touched on, the systemic anti-Black racism, also playing a major issue, in that even if you have the insurance card and you are willing to get assistance, you do not find mental health practitioners that are competent in a cultural sensitive context. So this is some of the issues that we have here. So we can say that it definitely inequality in mental health is a huge factor which one has to deal with. And yeah, alliances such as these are very important, in dealing with how these health factors are managed, and how the education, raising the awareness, reducing the stigma in our communities is also very, very important, because at the moment, everything is catered more or less to the Eurocentric, to the um, white clients. Yeah.
And there was something that well, in touching on that, there's this piece where what many don't recognize is that mental health has a lot to do, or should I say mental stability has a lot to do with one's personal identity,
Exactly.
country of origin story, indigenous status. And
Yeah.
when you begin to separate an individual from their identity, then there is this idea of conflict as it relates to one's, if you will, separation from their family of origin, from their country of origin, and there can be a crisis that's experienced with that. So we can go into that a little bit more as we move forward. Mr. Basiru, if you are there, you are. Unmute your mic, please. All right, there we go.
Yes, good afternoon.
So as we segue, can go ahead and speak again.
Thank you for this opportunity.
Basiru? Okay, good. There we are.
Yes,
So, and thank you for joining us. Let us know where you are speaking from, and what organization you're also representing. Because again, we're talking to a worldwide audience, and also you bring a lot of compassion to this conversation. And with regards to that, help us in this idea of inequality from your perspective, please.
thank you. I'm speaking from the Gambia. My background is public health and social work, and currently also pursuing my degree in psychology. I'm speaking or representing an organization called Peace of Mind, the Gambia, established with the aim to raise awareness and offer services to people that are having psychological issues in the country. When it comes to the topic of discussion today, from our own perspective in the Gambia, we have only one psychiatric hospital for the entire country. and the services are not decentralized, which means those in the rural areas might not get access to the services that we offer. And then the hospital also has only adult wing for male and female, meaning children or adolescents are not even catered in our system. Where will they go when they have issues? The few organizations also that are available here in the Gambia offering or calling themselves as mental health and psychosocial organization, most of them are offering only psychosocial services in reality. It's only a few that have the capacity to offer mental health services, like probably now professional counseling, psychotherapy, and art therapy, and a lot more of services. So if at the hospital is more medical, they focus more and they are more medical, and in that psychiatric hospital, there's no psychologist there to assist in the assessment, and also even when they are about to discharge, even the follow-up in the community. So all those things are issues that are affecting us as a country, and thereby only those who have the resources can reach out to a psychologist in a private and then be able to get certain services that their people need. A lot of the others are out there without getting any services that they need. In summary, this is the situation in our country.
So am I hearing you say that what inequality looks like in Gambia is access to services, which is maybe a wealth gap or an income gap, an insurance gap, possibly?
Yes, access to services is a big challenge here in the country. A few organizations that are out there are either funded to deliver services to a group of people based on whatever agreement they have with the organization that is funding them, or they are offering services to certain communities. So those in the rural areas are not getting access to the services they need. The only psychiatric hospital that belongs to the government is situated in the urban area, and it has the capacity of taking only 100 people. But when you look at in our statistics, they say that about 120,000 people suffered from mental health. And out of these, 27,000 people are having severe mental illnesses. Out of these, only 3,000 will receive professional care annually, whereas the remaining 90,000 that are suffering from this kind of diseases. So access to the services is a big challenge here in the country.
Thank you. Thank you. That gives us a lot of, well, I can't speak for everyone else, but that gives me a lot of understanding because coming or having grown up in the West, right, in the United States, being a retired military officer, sometimes, many times, services are taken for granted. And there's still a disparity because of the lack of services, right? And then there's a hint of, if you will, a bit of, for lack of better words, we would like to have access to more. But when I hear you say there is one hospital for the whole country, right? Considering how large this particular country is, I can only imagine how difficult. No, I can't imagine. I'm sorry. I can't imagine how difficult that is. On top of the fact that many of us, as a people and as a diaspora, don't have an awareness as to what mental health needs particularly are. So thank you. Dr. Bruce Golding, as we're speaking from the westernized perspective, can you support us in maybe what that perspective looks like on the other side of the Atlantic there?
Yes, yes. How insightful is it just to hear what's happening to our brothers and sisters in different countries? Just following on from Sister Oloruntoyin and what she said about life in Germany, I follow those sentiments as well. And you think about, as my background is in education, I'm a teacher. I'm also a mental health first aid trainer, and I'm a suicide first aid tutor. And, when I look at I think about, where does this start? When we look at the education system, I know of Black children being excluded from nursery, and, just those behaviors and those experiences can change the life course of that young person. So I think education is so important. Education within the home is important, in being able to have honest conversations about what racism looks like. I know growing up, for me, I think, my parents probably tried to protect me, and they probably thought, things are going to change. So although we did have conversations, I think the reality starts to hit you, and then you think mentally, you think, gosh, did I just experience that? And you start questioning yourself. So I think those conversations within the home are so important, for parents to say, this is what it looks like. Let's have these open discussions. And I know that there's a lot of research going on linked to racial literacy, and, us equipping our children to know what does it look like, and, having the use of storytelling and role plays and conversations to discuss issues around race. So yeah, I think for me, I worked with children who were excluded, and so there were high levels of Black children, and it's still the same. Black children from biracial children, mixed heritage, and also children with special educational needs. They were excluded from school, high rates of exclusion, along with Roma, Gypsy, traveller children. So we can already see, when we're looking at inequality, we think about those students who were excluded just before they took their GCSE exams, which would have enabled them to go to college. So they were excluded probably in the year 10 or year 11. So you look at the change, their life courses change forever unless they get the right support. So on one side, I'm looking at the importance of the educators being able to be open enough to have that honest dialogue with what's going on, their own biases on how they treat Black children and children of colour, because that's where it starts and ends. Really, the teachers have so much power over how far that young person's going to get, and then that also filters into the working system. So I think the inequality is embedded within our society, but the fact that we are talking about it and having a conversation, and what was under the carpet is lifted up now, so we can see. I think that's so important. important. We're having this discussion. We've got our colleagues from all over around the world, yet our commonality is very similar. We share the same story. So this space is amazing, and we need to continue to have these spaces so that change can take place.
Agree. And again, we're going to touch on what you brought up with regards to that inequality, especially from that Western lens, because there is this piece of many of us wanting to get back home, many of us wanting to help rebuild, and many of us wanting to support our brothers and sisters in the homeland. And sometimes, if you will, even glorifying the idea of abandoning Western living, where everyone else is, if you will, glorifying and wanting to arrive in quote unquote paradise, which is Western living. And how do we meet those two ideas and demystify them both? So again, the conversation is very needed in bringing both perspectives into reality. So again, thank you, Mr. Honorable Dr. David, returning to the platform with a wealth of knowledge. We'd love to hear from you. We understand that you are broadcasting live from Ghana. So please share with us, because we understand out here in the U.S. that we actually have repatriation rights and being able to go back home to Ghana and get dual citizenship even. Support us with what Ghana is able to do in bridging that inequality, and help us understand what your perspective is with that in this conversation, please.
Okay, thank you very much, and I'm most grateful for this opportunity. Speaking live today, 10th of October 2021, which is World Mental Health Day, and also being the personal assistant to the president for Black Mental Health Matters. I have been involved in activities of the Black Mental Health Project for some time. I'm also the president for World Mental Health Forum and CEO for David Nabari Foundation, the president for Community Mental Health Officers Association Ghana. Yes, in the perspective of inequalities, Ghana, like any other African country, such as what my brother Bashiru made mention of the Gambia, have the same or a like picture, but I want to pick it up from where you made mention of your return to Ghana. Ghana is a welcoming country. Ghana accepts whoever will be able to understand and follow the laid down principles and procedures, not forgetting that we have a working constitution and we are a democratic country. So the Fourth Republic, we have enjoyed peaceful transfer of power from one government to the other. And Ghana, we are a society of people that understand that we have ourselves at heart, and we love our brothers and sisters out there, especially our brothers of African descent. And we cannot talk about this without mentioning our forefather, Dr. Kwame Nkrumah, who was the giant of the Black Star of Africa. He was looking at how best Africa can be liberated and how we can make ourselves economically empowered. Yes, our inequalities span from this very historical perspective. When you look at what these are forefathers, Nyerere, Dr. Kwame Nkrumah, and so on, they were looking at all these issues. And as we speak now, every aspect of our lives that we face have an effect on our mental health as we speak. It could be your economic standing, your education, your health, whatsoever. It has some kind of mental health implications. So Ghana as a country, in terms of health and education in the country here, yes, for mental health in that regard, the Ministry of Health released just recently 3.1 million Ghanaians have various forms of mental illnesses, of which 16,000 have severe forms of mental illnesses. So as a community mental health practitioner, I ask myself, where can we keep these 16,000 people who are chronically ill? So drawing the line, there is an inequality there. And also access to mental health services. There are 3 institutions that take care of mental health cases are based in the southern aspect. So we have just heard the ruling government is making it to getting one in the northern sector, but that is still not adequate, because if you find yourself in any of the 16 regions, then you have to also travel to the cities that is in the southern aspect to have your mental health needs if they need specialized care. And this, it means that most of our specialists are found in the southern sector, of which if you want someone who is a consultant in child psychiatry, who is a consultant in probably maternal or reproductive psychiatry and so on, you have to go to the city. So that is where our inequalities find themselves. So the people who are found in the countryside lack access to professional help, because these professionals
Are
are
there,
found there.
David, are there doctors who are sent to the countryside at any point to assess, if you will, the I don't want to call them villagers, but those who reside in the outskirts or in the country areas?
Yes, so I am coming to hit on that. So the government of Ghana, through the ministry, looking at this professional client gap, brought in training to empower mental health nurses and mental health officers that are posted to various sub-districts, health centers, hospitals across the country. And almost all the regional hospitals and teaching hospitals have mental health units where they see mental health cases. And almost all health centers also have a mental health practitioner that is stationed there to see to mental health needs of these people. So this has been what the Ministry of Health through Ghana Health Service Christian Health Association has done to bridge that gap. But notwithstanding, if you still need an advanced care, it means these very cadre of professionals must refer you to the cities to see some of these professionals. So as our sister mentioned, Dr. Bruce, education actually affects our mental health, and it's also one of the things that we look at when we're talking about the inequalities, because the education will surely empower us to be able to handle cases in that regard if we want to do specialized training. But as in Ghana we speak now, much is still yet to be done to get people or members who are practicing to get trained. So I am of the view that as a practitioner, as an advocate for Black mental health matters, today being World Mental Health Day, the inequalities that we are seeing, some of them are, should I say, born by we, the people who are supposed to perfect the system. So we are calling on our governments on the continent of Africa and elsewhere that it is time for them to call for policy direction. It is time for them to also look out for what we can do to bridge these gaps in terms of inequalities, because all that we look out for is that most of these people find themselves in the countryside or other aspects of they are find in the poverty gaps. So it will be difficult for them to access mental health care and even healthcare in general. And this goes a long way to affecting the way the mental health of the people is. So notwithstanding suicide and attempted suicide, yes, also has issues when it comes to talking about inequalities, because looking at our laws now, Ghana still criminalizes attempted suicide, and you could be jailed for 3 years, hard labor, for attempting suicide. And in the year 2021, 417 cases
Yeah, and
reported
we
by
talked
Ghana
about that
Service.
before
So,
on the last forum. We had brought that up, and that had really, I believe, struck the audience that in places where we are trying to become very, should you say, modernized, very aware, and very, should I say, 21st century isk 20 we still have these very old colonial types of laws that are still if you will criminalizing the human condition, right? I want to give Sister Ruth a opportunity because we've yet to hear from her, and thank you, David, because we're going to circle back to these class, status, wealth, and racial gaps that you're speaking on here. Sister Ruth, we've yet to hear from you. Please introduce yourself, where you're representing, where you're from, some of your accomplishments, and then some of these inequalities that even David might be speaking to.
All right, thank you very much. Ayomide Ruth Agbenga. I'm in Nigeria and I'm in South Africa at the moment doing my master's in biology. But as you all were speaking, I was just thinking that I grew up to, with this mindset of when we talk about psychiatric, mental health issues, actually the general thing you would hear from Nigerians would be, hey, yeah, like, oh, sorry, oh my God, like, wow. So you ended up like, it's a conversation that people don't want to, should I say, accept. So even the idea of psychiatric, going to the hospitals to see the doctors or something, it's something that has to be private. Like a lot of things go on that even patients can't easily talk to family members or even friends about it. They have to go private. So in that sense now, talking about public psychiatric hospitals or wards in Nigeria, and then we also have issues with the local ones. Oh no, the local ones, the local centers whereby people just put a serious mentally case of patients and just drop them there and they go through a lot. Or should we talk about the deliverance homes, the churches that have to go through a lot of deliverance, a lot of things just to because of the mental health issues. So I feel the inequality in the sense is I think it's still with the knowledge gap, because we don't really have a situation whereby anybody can easily come out and say, oh, okay, I'm having this issue, or I want to just go see the doctor. So I feel in Nigeria, basically, when we have this knowledge gap breached, when we have our mindset condemned, like our mindset changed, that these are things that just like we take care. It's easy for someone to say I was sick of fever last week, that for someone to say I was having issue with my mental health and I needed to take a break. So I feel that is one major thing that's all over in Africa, in some parts of the world we still need to address, so that okay, if at all we need centers to be established in the local places or in the cities, at least people will be glad to go there. People won't feel ashamed or stigmatized to seek mental health care. That's just what I have to say for now. Thank you.
And thank you very much. And one of the first mental health assessments, I don't know it by name, but I'll just describe it for you here in the US, was for slaves, right, who would run away from the plantation. So, and they were deemed as crazy, if you will. Um, on the other side of that, I would think that you'd be crazy if you wouldn't run away from the plantation, right? So, we have to understand the history of psychology and mental health diagnoses and the institutionalization of, if you will, mental health, and why the stigmatization was, or should I say, the foundation of stigmatization from the Western lens. Because remember that modern psychology, from the clinical or Europeanized standpoint, now we're not talking about the ancient African cosmology of things when we're speaking of the relationship between body, mind, spirit, and we're talking about the founders, right? Tehuti, Ptah, and the other great um, alchemists of our ancient societies. We're talking about through the Europeanized lens that was attempting to justify the racial, should I say, superiority of their practices. Okay. So again, Ruth, when you speak of this knowledge gap, it's more than just simply the lack of understanding of clinical diagnoses, right? It's the lack of understanding or knowing why these diagnoses were created in the first place, right? So I think that when it comes down to access to mental health, it being separated by class, status, wealth, and race, this conversation has to be dove into from a much more, if you will, conscious perspective, from our perspective, right? And excuse me. And it's not so much because this information is unfounded. All of this is research-based material. So I like to open up the conversation here and not being the only one who thinks this is some whacked out conspiracy. Who else has found some of this in the materials that they've researched? And I just like to open up the floor to anyone who would like to take this conversation to a different level.
I'll jump in and talk about my research, and most of my research was done from my book that I've been working on for 7 years, called "The Flock of the Slaughter," and basically, it takes a look at the BIPOC community for young adults and the impact of violence and racism in Chicago. And a lot of that research came from case studies, me working as a mental health professional many years ago, and working in the capacity of doing a lot of surveys to talk to other healthcare professionals, especially in the mental health space, but focusing on mental health professionals who are also impacted in across urban areas in across the United States. And what my research found is this power structure. And when I do want to just identify, because I was talking to another colleague and she happened to know what BIPOC meant. So BIPOC, I know this panel probably knows what that means, but it's Black, Indigenous, and people of color. And so, but maybe the audience doesn't. And so this focus of my research for the book was working with a young man who was struggling with being overdiagnosed. He had struggling in school. He had a learning disability, and then being overdiagnosed with having depression and schizophrenia. And that's happening a lot in our community. I need to name that right now. I'm very passionate. I'm a woman. I'm a wife and a mother of 6 wonderful kids, and 5 of them are young men. And so it's really, really, I took this to heart. And guess I guess I'm a little emotional about it, because this young man reminds me of my son. And it was just interesting, the things that he went through, and just talking to him and doing some just general work. And we've got the consent from his mother, coming from being in Chicago, in Inglewood, which is a very, very, very tough neighborhood. And then now I could say to this young man, he's now in college. But what I want to say is that the things that he went through the education system in Chicago, the things that he went through just struggling being a teenager, right, in our society, and the things that he was going through just internally about his identity. And so a lot of the research for my book was focusing on those aspects, those inequalities that we talked about earlier, but education being the center, because what he was being taught, and what he was being taught, not just in school, but out of school, right, in the community, is the lack of self-worth, not feeling, and overall, the racism being devalued as a human being, but also as a Black young man. And so it's really interesting as we have these conversations and taking it to another level about the research I've done for my book, but overall, just as a parent, right, as a professional, bringing that perspective and that lens, right? And, it's different because there was different multicultural lens, in looking at the research and just the stories of, not just for this young man, there's 4 other individuals I also was working with in my research. And I just thought it was really interesting, just their perception and how they feel they're being viewed in the world today, our youth. And to me, it's imperative that we talk about our youth and protect our children. And so it was just really resonated with me, just the fact that when I was working with the individual and then his family, just offering a lens for him to feel that he had a voice and that he was important and that he mattered, because society was selling him differently. The education system was telling him differently. And he had a learning disability, and it was marked up to be he was misdiagnosed and just, it's just a very unfortunate situation, but he's turned it around. But I just want to say that that's part of my research that I've been doing for my book, and it will be, hopefully, I'm finally done with it. But it was a great learning opportunity to work with the BIPOC adults and the teenagers to kind of get their stories, and then also working with the veteran community to talk about their PTSD and other issues. So the book encompasses a lot of great information and research.
And thank you. I've seen some of that research, the overdiagnoses, the general diagnoses, right? Or should I say the generalization of the diagnoses? Because again, when we're coming to from the Western side of things, and it's money driven, sometimes what you have, and this is for folks who are tuning in who may not be aware, when money drives things, then what you have is sometimes, or many times, malpractice, right? And you will have particular diagnoses or over diagnoses, multiple diagnoses, which are not fitting to the individual. And out of those diagnoses would be particular medications, and those medications are really expensive, and the insurance can be billed, and out of that billing, the doctors will receive the proceeds or the funds. So again, we have to be, as advocates of our, should I say, those with these disabilities, these inabilities, right, to advocate for themselves, to be in the position to be their caretakers, to speak for them, to speak up and support them. In the same respect that if you had a survivor or someone experiencing a cancer diagnosis, would you allow for them to be overprescribed medication or underprescribed even? Why we don't treat mental illness or health in the same way, it's difficult because what we see are the behaviors of such, right? But if someone with pancreatic cancer is in pain, we don't yell at them typically, right? We don't act, should I say, I'll just use the term, out of pocket. We don't re-wound them. But if someone is schizophrenic, if someone is bipolar, if someone is reacting from trauma, what we see is the behavior. And because of the behavior, we're more inclined to personalize it and then react. And then it causes the back and forth of things, and we step outside of the empathy and the compassion, and we become attacking, and then the whole disregard for their illness becomes the inequality of the system, if I'm making sense, right? So again, as we move forward, let's talk a little bit more about that, because the inequality is very apparent. The research talking about the Sister Olorutoyin, this inequality that you had brought up before, out of Germany. Please give us more insight if you've done any research or have just any insight. Please share that with us.
Yeah, I would. I find it all the point that was made about the knowledge gap, and this is what we find also here. Knowledge gap, not meaning actually knowledge of who we are and how we define illness. So definitely here we are trying to, in my work, I'm trying to include the community and to try to have like a community-led programs which deal with these issues which we mentioned. The methods, the mainstream methods, totally do not consider the historical and social determinants which are there. And even the system, as you rightfully said as well, the history, the racist history of psychiatry and psychology poses the question if it is possible to heal in such settings. So definitely there has to be a combined approach which is more empowering to our people. And that is also more holistic. It cannot be simply medication, as you pointed out, but we have to move from treatment to healing and consider the mind, the body, and most importantly, the spirit has to be a part of it. And that is which we've tried to find culturally safe services. And Dr. Bruce Golden mentioned it. A simple thing like storytelling is very therapeutic. And as we work, and those of us who have trained in Western psychology or Western psychiatry, I think it is important for us to start to reclaim and regain these healing approaches which have been oppressed and suppressed. Yeah, because even in our home countries, we have taken on the methods of the colonizer. So the system, for example, which we now call tradition, are actually not, where people are kept in a room or tied up and neglected. There's nothing traditional about this approach. These are
absolutely
helpless methods which some people have taken over, mainly from colonial approaches and we cannot have these. We have to really look into our traditional, our cultural healers, our elders, and start to incorporate these practices in our healing sessions and not just treatment. Storytelling, most people, the mental illness is already there, and not here in Germany, for example, not having a space where one can even articulate the distress. Yeah, it starts already where the stressors are not even recognized or acknowledged. So I think it's very important that we start to include community care as part of treatment, as part of the services that we offer.
Takes a village, right? Takes a
It takes a
village.
village.
And it takes the elders, right, to lead, because they've seen what works and what hasn't.
Exactly.
Yeah. Thank you for that. Basiru, what would you like to see improve in Gambia?
I think I would share the same things with my sister, the previous speaker, in terms of capacity building or awareness, even among the service providers, is something that is very, very necessary. And as an organization equipped with psychologists and social workers, we've taken this step to collaborate with the only psychiatrist in the Gambia to build the capacity of the staffs so that we can have a common understanding and have a holistic approach when it comes to mental health, and not only to take the medical aspect. We've started with few sessions with different groups of the psychiatry. As I said before, the hospital don't even have a psychologist in the among the staffs. One of the things that we as an organization want to offer to the hospital is at least for our psychologists to be visiting the hospital and then work with the psychiatric doctor once every week. And our social workers also collaborate with the social worker, because the hospital have only one social worker, could you imagine? To collaborate with the social worker at the hospital to be making home visits and even the follow-ups, provide some psycho-educational to the families as well. We believe when the families also are aware, that will reduce the discrimination to these people that are already affected. But even providing the space for staffs that are in there to have a place where they can also debrief. You cannot be working in such a hospital and don't have anywhere to go to debrief or for counseling also whenever you need it. But also we have reached out to different organizations and asked them to send a representative and then provide capacity building to these staffs so that we will all have the same common understanding on how to approach certain cases. My boss, who is a psychotherapist, once shared some of the data of the clients that she usually sees. And she said 90% of the female clients that she sees have gone through some form of sexual abuse at one point in their life. That might not be the reason why they were there.
Trauma. Yep.
Yes, but that play a huge part as some of the reason why the individual is still having these problems. And for us to be able to have that common understanding, we believe that the service providers also need to have that knowledge. We are also reaching out to the schools, providing sessions with the students with our program called Emotional Intelligence. And we come up with activities in which students also can share some of the experience that they have gone through at school or at home. and you hear very touching stories from the students. A particular student shared a story and saying, what I'm going through right now, my mother is talking to me, and whenever I close from work, she will hug my siblings, leaving me alone. I try all means to find out what have I done wrong, but she never responded. So this boy picked up also a fight with his siblings for nothing. His grade also start dropping at school. And one of the teacher that he believed is a source of help started calling him a stupid student. So you can see the lack of knowledge from the service providers up to the community is something that we want to see improve here in the country.
And I'm hearing you say that collaboration. That collaboration is very important, and the understanding of we necessarily don't have to know every little tidbit of what's happening in the household, but again, the community, and that's what we've always been as a people, as a diaspora. And when you separate our mindset from the aspect of community into this individualistic me, very selfish type of idea where we don't see ourselves in others, or don't see ourselves in nature, or don't see ourselves in the world, or even the cosmos, then of course it's very difficult for us to be compassionate, be empathetic. So I definitely understand. We're going to have to start to close things out. So I want to give Dr. Bruce Golding, Ruth, and David another round for themselves. So any closing thoughts for you all? And we will start with Dr. Bruce Golding in these ideas of closing the racial wealth and class status of mental health inequalities. When you hear that a country only has one hospital, or even from the perspective of us as a people, we feel as though mental health is an enigma, right? Is not important. That it's a byproduct, if you will, even of I'll put it this way, and again, I'm ordained. I am also an author, right? But a byproduct of demonic activity only, right? I'm not dismissing anyone's spiritual traditions, but again, so Dr. Bruce Golding, when we are dismissive of our holistic well-being, how does that contribute to inequality?
Wow, that's a big thing to miss off.
Sorry, I didn't mean to just boom, just leave.
Yeah, no. I think it's important, just the whole idea of a holistic approach to healing and managing emotional distress. I think it's so important, and I think we do have the tendency of just compartmentalizing lots of things instead of seeing that, as Sister said, Olarontoyin talked about community, as you mentioned as well, Marcus, the importance of community and that togetherness as part of our healing. That's so important. And I think even just outside that, when I think about trainee counselors and trainee teachers, the responsibility, especially for Black trainee counselors, we need more, because we need those teachers who are brave, who are going to challenge the theoretical approaches that were given, to sort of question, who was this? What was the sample like? Who was this written for? How will it apply to people that are different to the dominant or the traditional ways of thinking? But I do think there needs to be more of these more tailored community programs that address mental health, well-being through the way that we like to express ourselves, through the storytelling, through movement, through multisensory approaches that allow us to express how we want to express ourselves. So I think that's so important. And, you know, as a little extension for us to continue to explore, we're learning, but to explore theory. And as you said, Dr. Dia, is that right? Thank you. You've got a book coming out, you know, Marcus, I've got your book, I'm reading through it, and I think this is how we learn and we respect your lens on the world, and we can then use that within our wherever we are in the world. So I think this is so important. I've got another book called The Color of Madness, and that's really interested in exploring Black mental health in the UK. And another book that I've got, which is called Black Identities and White Therapies. So already the conversation is being had in thinking, okay, well, how does this work? Will it work? If it's not working, we need to have what's next. This is part of the new narrative of supporting our young people and adults in the community. And when I think about our elders, you know, they have been through it, and they are probably still needing the healing and support. They didn't have those spaces maybe to express what they were actually going through. So this is a journey, and it's special to be part of it with you today.
Absolutely. And thank you. Thank you. So I appreciate you mentioning those book titles. And Dr. Dia, if you could please in the chat provide your book title, maybe some dates that that you expect for it to be published, and we will post it here in our comment section so that everyone will be able to see it. Mr. Honorable Dr. David, if you could give us some of your closing thoughts in support of bridging the gap of these inequalities. I believe you're on mute, Mr. David.
Yeah, thank you very much. And sorry, yes, I believe that in this conversation, we are looking at bridging the gap and solving the situation or the problem of inequalities. So as a professional, when I was phantoming these very issues of solving this problem, I look at it, we need resources in order for us to be able to bridge this gap. And who is expected to provide these resources? The number one is our government. So I would call on our governments to appropriate more budget funding for mental health services across countries, because in my country, Ghana, little is done for budget appropriation in terms of mental health. So for us to work at these inequalities in terms of providing logistics and resources, more funding and investment should be done in mental health, so that where we expect to have more facilities built, that can be looked at to serve the greater majority. Yes, notwithstanding all these, when they are done and we who are expected to spearhead these particular issues do not have the capacity and the knowledge base, it will be difficult for us to implement whatever change that we are looking out for. So I am also saying that most organizations, and through Black Mental Health Matters, I think we must build capacities of advocates and professionals to look at these issues of inequalities, so that we change our conversation. When we change our conversation, we are actually going to change our community. And when we change our community, the people in our community are going to change. So we are calling on our professionals health workers that the change starts from us, because at our facilities level, you could not be a mental health practitioner. But if you are able to understand that if someone even comes with malaria, the person has mental health needs, therefore you're supposed to treat the person with care. If somebody has cancer, yes, these are issues that we have to look at as a people. So when these, should I say, structures and protocols are made, there will be an opportunity that our community members that we are looking to serving will come forward to join us in this emancipation. This is a very great emancipation that we are leading in the 21st century, starting from us. So as advocates and professionals, we are gathered here in this assembly talking to millions of people out there. We want our government, through relevant organizations and NGOs, to also buy into the idea of seeing that these inequality gaps are, should I say, eliminated, not forgetting stigma and discrimination that has bedeviled our societies. Because when you look at mental health issues, even at the community level, where the community should understand that this person actually have a mental health problem, that is where stigmatization is even seen at the glare of our side. So we want to tell our community members that mental illness, it could be anybody. Mental illness, it could be you. Therefore, so far as mental illness, it could be you. Look at you in the treatment process, how you want to be treated. Then you treat somebody in this situation. So we are all calling for policy direction. We are all calling for more investment. We are calling for capacity building. And we are calling for members to join Black Mental Health Matters in this particular day of our year, October 10th, 2021, World Mental Health Day. We have come to them. We are calling on them. They shouldn't leave us. We want them to help us champion the cause of this mental health revolution for people of Black or people of African descent, and also for people in the African continent and elsewhere. Because where are we going and what are we doing now as a people? When I get the opportunity to meet my minister, I always tell him that, Honorable, the best thing is to prioritize our mental health. When I meet any director, I tell them. So let me use this opportunity to also thank the Chief Executive Officer for Mental Health Authority, Ghana, because he's been so instrumental to ensuring that community mental health is realized in this country through relevant NGOs, relevant organizations, and the government, seeking support from wherever he can get. And also, we want the Parliament of the Republic of Ghana and other parliament in the continent to prioritize mental health, because this is where our health is anchored. Therefore, they should change these archaic laws that are holding us onto not moving to a different level as a people. So God bless everyone for joining us from far and near. I have met seasoned speakers today, Dr. Dia, Ruth, Bruce, Bashiru, our host, who has taken us. In fact, I'm so amazed that the program, though I'm yet to listen to you, whether we are closing or we still have some few minutes, my viewers and followers are out there that what we are doing, they will surely join us in realizing our dreams for Black Mental Health Matters project on the continent and around the globe. As the personal assistant, God bless everyone who is with us from now and moving forward. Thank you very much.
Yeah, and we're going to segue on over to Ruth, because Ruth hasn't, and thank you, David, because again, just being able to acknowledge what is happening there in Ghana, again, the inequalities, the disparity, but also the work that is happening on behalf of, should I say, the policy makers, because there's two sides of the coin, so to speak. There can never be enough, but there's always too little, right? So Ruth, if you would please help us with some of your thoughts that you've gathered while many of us here on the panel were kind of being the forward thinkers because I know that there was a lot here that was said.
Yes. Okay. In conclusion, I think there is still so much to be done. And so the work lies on all of us, like all of us. Just like you said, it takes a village, ne? So the work lies on all of us to keep making these gaps in the knowledge, in the health sector, whatsoever situation, even in the gender, the way we view, even religion, the religion aspect to how it influences the way we view things. So it lies on all of us to bridge this gap, because maybe 10 years from now, 15 years from now, we want to see the impact that Black Mental Health Matters and other organizations are really doing. Like, we want to see that, okay, what we've been doing now would matter even in years to come, and even for generations after us, because that is just it. If things were like the way they were probably in the 80s and the 90s, then we're in the 21st century. We just have to get better. We just have to keep, pushing it, so that at least we know that we are doing something, and yes, we'll see the results in the life of people around us. So that's just it. Thank you.
That's beautiful. Thank you. And so again, we are Black Mental Health Matters. This is World Mental Health Day, mental health in an unequal world. I've been your host, Marcus Banks Bay. Though I am a Master's of Divinity holder, I am a doctoral student of clinical psychology. I've done many things to include 5150, if you will, psychiatric holds, assessments, working inside mental health institutions, doing psychiatric evaluations in the community. I've had many experiences in supporting individuals who have been experiencing psychiatric emergencies, crisis management, crisis stabilization. These are the things that I am passionate about and that I specialize in, not only should I say in the community, but in on the should I say global field, as a retired Army captain and chaplain. So this is what I bring to the conversation, and I don't speak to it very often. But again, these are my passions as well. And I want to thank all of our panelists today. I want to thank everyone who has brought their personal and professional experiences from the world lens of the African diaspora. This is not the end of should I say, conversation. This is just the end of this particular show. So again, thank you all for tuning in, and thank you for your time. Revisit us. Find us on LinkedIn, find us on Twitter, find us on Facebook, and let's continue the conversation online. Thank you, everyone, for tuning in.
Thank you very much.